Hello, everyone. This is Jody Kennett. Thank you for joining us. You are in the right place if you have come to join the Hip Replacement and Hip Arthritis Exercises free webinar. Really happy to have you here. So glad you took time out to join us. I'm so passionate about this topic and can't wait to share the information with all of you. So you may want pen and paper, you may want to take notes, feel free to do so. Just a few housekeeping things. You will have a question and answer thing that you can actually click and put your question in. I may not be stopping to answer your questions during the webinar, but I am definitely going to make sure at the end to leave time to answer all of your questions. So please do, as the question pop up, put the question in the side box and I will attend to your questions at the very end. So I just really wanted to thank you for taking time out. You are here for a reason, and you could be here because you are pre-operation, and some of you are here because you are post-hip replacement surgery, and I'm going to be covering exercises on both of those topics. So sit back, relax, do stay focused because there is so much great content here, and there's actually some very specific information. But so we are not strangers, I wanted to share a little bit about me and my journey into hip replacement exercises. So I actually first took kinesiology at Simon Fraser University, and I took it because I just loved the topic, really. And I remember taking my favorite course. It was a rehabilitation course, and I wondered what I could do with it and how I would use it. But I just remembered absolutely loving that course. And when I graduated from Simon Fraser University, my very first job, I absolutely lucked out. I actually fell into a community center type place, and right away there, I actually was able to jump into what was called a joint replacement program. And it was actually a community program that first started because our local hospital was so overloaded with patients that the head physio there said, we need community outreach. We need to kick these guys out of our class, but we need to make sure they have some place to go and learn how do they keep up with exercises. And she really wanted it as a graduation step, that they did the rehab and then they continued learning how to do exercises and get stronger because she saw the value in people continuing to exercise. So what she did is said, you guys need to get started. I'm going to refer people to your program. And that's exactly what she did. I started in that program at the very beginning. And here is what happened. Our program actually maxed out at 12 people. That's all we could afford in the class because we were actually operating the class in a very small weight room that actually had other members doing exercises at the same time. And here's what happened. Our program became so popular, people didn't want to leave it. And so we had to create a graduation class. And what we did is we created a level 2. That was our first step of creating another class. And we created that level 2 to make room for new people to come into the beginner class as the graduation step from the hospital, but also we knew the other people needed extra help and ongoing progressions. And that is where we stopped in that one facility because that's all we could handle. But luckily, our whole facility actually grew and we got our very own exercise studio. And here's what happened. The demand for people coming into the class, partly because we had such a great relationship with the hospital, partly because people, once they started, didn't want to leave the program and saw the benefit and loved the group format, they stayed. And the other part was just the word of mouth got out about what this was doing for people and what the exercises were doing. So our overall group programs grew to 6 classes of 12 participants. We ran them 5 days a week, Monday through Friday. I think we had 2, maybe 3 classes, Monday, Wednesday, Friday, throughout the day, all different times. We had one for the people who were still working early morning. We had a lunchtime one, afternoon time, and then we had midday times. Tuesday, Thursday, those were really popular for people, the twice a week option. And from there, here's what happened. We realized we needed more trainers. we also realized that this course and this program had to get out in other communities. It was just so high in demand. We knew that we had something unique, and we knew we had to share what we had learned. So the very next step was actually creating a course for trainers. And we did this through different educational places and partners. And we taught trainers throughout BC. I'm from Vancouver, and the community I worked in was actually West Vancouver. But we started these workshops and got them out all throughout BC. But that's kind of as far as I could get in terms of being present and teaching the course in person. I even had some people travel from out of town to come see it. But I knew we needed to take the next step. And what happened next was a few participants came into the classes and they said, Jody, my friend in such and such city or in the States or here or there, they want to find a trainer. They want a program like this. What can they do? And this came up numerous times. And I thought, you know what? We need to get this information out to as many people as we can for anyone who's looking for it, because we have a wealth of information here, because we literally had seen hundreds and hundreds of people and had learned every exercise that worked, every exercise that didn't work, that we knew would cause pain, and we knew the progressions. And really, we were actually almost somewhat, even though it wasn't a sanctioned or planned study, we literally were a study. And one of the head physios in all of Vancouver said the information you guys are getting from your group class, it needs to be documented. It needs to get out there. So the next step from our clients and participants saying, what can my friend do, is I knew I had to put this into a program that anyone, anywhere could access and have the ability to do, whether it was at home, in their community. And so I created an ebook and video as a first step to reach those people. And we're here today because I have more information to share with you. And I really just want you to know that an exercise program for people who are waiting for hip replacement or post-hip replacement surgery, it is very different than just jumping into a group class or jumping into a regular training program that a personal trainer would devise. There are so many unique guidelines that need to be considered. We've learned them and we're going to share them all with you. So let's jump right into why is exercise so important. If I haven't convinced you already, this should. So here's the thing. Exercise is wonderful. It will actually lubricate your hip joint. And here's what happens when you get arthritis in your hip. The very nature of osteoarthritis is that it actually wears away at your joint. And as it wears away at it, it creates inflammation, it creates swelling, it creates a situation where you're bone on bone because the cartilage is worn away, and that increases stiffness in the joint and it increases pain. Now, exercise, and I'm going to tell you exactly what type of exercise, but doing exercises can actually oil your joint. And by oiling the joint, you actually can decrease some of that stiffness and you can actually decrease some of the pain. Whether it's temporary after the exercise, it is going to give you relief. You're going to be able to build strength and some stability in your hip joint. And there's what happens when you have pain, whether it's knee arthritis or hip arthritis, when you have pain, your muscles actually know that and they get signaled to tighten. It's a signal of, oh, there's pain, let's tighten because we need to stabilize and we need to protect this joint. So exercising can loosen those tight muscles and it can help you prior to surgery. It can help you prevent loss of muscle strength, loss of range, and it can help you maintain range of motion and in some cases even increase your range of motion. It most definitely is going to help you with your walking, with your balance, your cardio, and your everyday function. So, what exercises are best for you? So you can see 4 listed here. So the first type that is best pre-surgery for hip arthritis is range of motion. And range of motion exercises are very gentle and they just take your joint through its pain-free range of motion. Okay, the next one I want you to focus on is muscular endurance. And I put the word endurance there because it's different than strength. Muscular endurance means you are working at a low intensity, low load, and you are just building endurance through higher repetition exercise. Okay? The third one there is cardiovascular. This is so important to maintain your cardiovascular conditioning because walking is going to slow down due to pain, and you're going to need cardiovascular conditioning just to maintain your aerobic capacity and your heart health, especially if you have any heart concerns. And the fourth one is core stability, and that you're going to see later some pictures of all the core muscles. Okay. Now, there are specific guidelines. There's different guidelines pre-hip replacement surgery and different guidelines post-hip replacement. I'm going to cover right now the two main guidelines you want pre-hip surgery. So if you have arthritis right now and you're wondering, what are the exercise guidelines I need to follow? The first one is choosing non-weight bearing or low load exercises. So the non-weight bearing, it can mean just your body weight. In some cases, if you have pain with your body weight as an exercise, then you need to go to completely non-weight bearing exercise. Okay? And low load means, this could mean, if you have groceries and lift 2 groceries bags that are 10 pounds each side, that's extra load above your body weight. If you're lifting a 10-pound or 15-pound heavy cat, that's above your body weight. The same thing goes for a 20-pound or 30-pound toddler. If you're lifting up your grandchild, that can be extra load above your body weight. That can be causing inflammation and pain. So you need to be aware of non-weight bearing exercise. The other guideline I want you to be really aware of, and I want my voice ringing through your head when you're doing exercises, because they used to say, no pain, no gain. And I want you to toss that expression out the window. You need to work only through your pain-free range of motion. What this means is if you are working your hip and you start to move it through a certain range and you feel good, and then 50% through your normal range, you feel pain, you have to stop. You need to use pain as your guide. And you see there that the reason we want to stay away from pain is because pain means you're going to increase inflammation on top of the inflammation you already have. And inflammation decreases range of motion, and it decreases ability, and it's going to limit the amount of movement you can do. Okay, so 2 guidelines, non-weight bearing and pain-free range of motion. Use pain as your guide. Here are the precautions for hip arthritis. So if you are given exercises that load you, you want to avoid these. Now, if they don't cause pain, go ahead and do them. You are going to be the advocate for your own body. So if you can do a body weight exercise like a sit to stand from a chair or a squat, and you can do 10 reps with no pain, go for it. What I want you to be aware of is the loading. So if someone wanted to load you with a weight bar, or you loaded yourself with something and then it caused pain, that's what you need to be aware of. Here's something most people do not think of, and I saw this time and time again with many of our clients. The daily volume of exercise you do matters. So here's what we would see. We'd see people coming into our class, and they'd come for a couple weeks or a month. They might even be with us for 3 months. No problem. Felt great. Everything was going excellent. Then they'd come into the next class and they'd say, I'm in pain. We're doing something. What's going on? And we wouldn't have changed their exercise program. And so we would start to inquisitively ask them investigative questions and say, okay, what did you do? What did you do Thursday? What did you do Friday? What else did you do in the day? And what we determined is, if they came in and did a workout with us, and then they went off and did a long walk with their daughter, or went for a hike, or you know what, their car broke down, they had to walk away. If they added gardening in or a whole bunch of housework, any extra activity, what we found out was that each individual had their own daily volume limit. And if they went past that limit, they were going to cause pain. So what I need you to do is track and find out where your limit is. I don't want you to push your limit, but if you're getting pain, you need to look at, what have I done in the day? What are all the things I've done? And then you need to find the right volume or the right amount of exercise in a day that is right and correct for you. Okay? And any exercise that is going to increase pain or going to increase inflammation that is felt during or after exercise, you don't want to do. I'm going to say don't do that exercise. It's not the right one for you if it's increasing pain. But even though there is the potential for pain with exercise, you really do want to keep moving, because movement is going to make you feel better, and it's going to improve your strength. It's going to improve so many things. So don't be worried about pain. I'm going to give you the guidelines that are going to keep you out of pain. All right, let's jump into some specifics here, because I know you guys want those. So here are the recommendations for what you can do aerobically or for your cardiovascular conditioning pre-operation. Highly, highly recommend the upright stationary bike. It's number one. Here's why. There's no load. You're hanging at an angle where the joint can actually release out of the socket, and it's a great range of motion exercise. All right. That one is excellent, and I prefer it over the recumbent bike, because the recumbent bike, you're sit at an angle where hip flexion is a bit tight, and it's just not as great as the upright stationary bike. Having said that, if you have back concerns and you prefer the recumbent bike, go for it. Just stretch your hip flexors out after using it. The second option, pole walking. It's Nordic poles. You can see poles in the picture there. They are fantastic. If you're someone who loves walking outside, the poles actually absorb some of the shock off of your joints. And so they're going to deload your joints, which is going to allow you to walk longer, have greater endurance. You're still going to have to track what the right distance is for you, or track it by time. Okay. The last option I would say here is pool walking or jogging, or an arthro-size class. It's kind of like aerobics, or it's kind of like aerobics in the water. And what I would say about this is it is fantastic for range of motion. There's no body weight there. You're not going to have pain, so you can work through a great range of motion. However, if you are going to choose water aerobics, I need to ask you to add in something on land as well, strength training on land, because here's where it is great and here's where it is not great. It's great in that you're going to get your aerobics, you're not going to feel pain, you're going to get great range of motion, and maybe you're someone who loves the water. So go for it. But here's the limitation. We don't live underwater, and we need to build strength to do things on land in our everyday activities. So as long as you pair that with land strength exercises, it can be a good combination. All right, I mentioned range of motion exercises first for pre-op exercise option, and here's why. It is going to help you maintain your range of motion, which is the number one thing arthritis is taking away from you. It's limiting your range of motion. And that stiffness you feel. Range of motion exercise can actually oil the joint and help release some of that stiffness and tightening you feel, okay? And you can do range of motion exercises easily at home, anytime throughout the day. How often should you do them? Daily, and if you can't do them daily, or that's too much for you, 3 times a week, optimal, okay? And what will it do for you? If you do range of motion exercises pre-surgery, it is going to do amazing, amazing things for you after the surgery. What you can expect and what we have seen is the people who keep up their range of motion have actually prevented loss of range of motion. And afterwards, the range of motion is what allows you to sit down on the toilet, allows you to get in and out of the car. It allows you to sit on a couch and get up off of the couch. It allows you to have a normal walking stride. So range of motion is actually important for everyday function. And by having range of motion, it also allows you to build strength through a full range of motion, which is the key to be able to being independent and having full function in activities of daily living. Okay, so we've talked about range of motion. The next most important one is strength exercises. So since we've explained the range of motion loss, the reason you need strength is because you're going to lose strength prior to surgery. And you're going to lose strength because, number one, you're in pain. So unconsciously, you're actually shifting weight to the other leg. And unconsciously, your body's saying, protect, do less. It's painful to do exercise. So you're actually going to slowly decrease so many things you would have normally been doing in your daily routine. And all of that is going to compound to loss of muscle mass. Okay. And so by doing strength exercises prior to, it helps prevent some of that loss. It helps maintain some of the strength you already have. And it keeps a base so that when you're ready to go post-surgery, you're actually going to recover quicker because you have that base. The muscles have still been they've stayed working for you. Whereas if you don't do any exercises, they're just going to completely atrophy or shrink, and they're going to stop working. Okay, and we've talked a lot about maintaining your function. Strength and strength exercises is what helps you be able to do everything you want to do on a daily basis, whether it's your daily routine at your home or whether it's the hobbies and things you enjoy doing. Okay, so what exercises are best for hip arthritis? And I have videos of these. I'm going to show you where you can see them later. So I'm actually going to skim through them quickly here. But most important is gluteal strength, especially if you have had a medial or posterior incision. I'm going to talk about incisions in a moment. The clamshell or side leg raise is an example of exercises you can do if you've had a medial incision, but they're just as important if you've had a posterior incision. And hip extension or prone, it's also called like the Superman or 4-point prone hip extension, is a great one if you've had a posterior incision. Core stability is great for any incision you've had. That's working your deep abdominals, which stabilizes your pelvis and your back, and it also aligns your hips, which is important for stabilizing and balance and all those things. And a bridge exercise is an exercise that's going to work your glutes, your core, and your range of motion all in one. Functional exercises like a sit to stand from a chair without using your hands and doing a squat, a free squat, either have a chair behind you or just do it free if you have the ability. Those types of functional exercises are really going to help you maintain strength. And again, all of these are only done through your pain-free range and if you do not experience pain. And one important note here, if you have access to a weight room or to a gym and can do some one-leg exercises like a shuttle machine that is a low-load leg press. It's not a traditional leg press, and I don't recommend a traditional leg press for you. But if you can do one-leg exercises and maintain strength in that leg that has arthritis, you're going to prevent a lot of loss that's happening, and it's going to help you recover post-op. So, why is it so important to know where your incision will be? First off, I want to say if you've already talked to your surgeon or already had your surgery, every surgeon is actually specialized in a certain incision type. So if for some reason you wanted a specific incision, then you will need to find a surgeon who specializes in that. But here's the type of incisions you can have. You could have an anterior one, you could have a lateral one, or a posterior one. Anterior one is right in front of your hip. A lateral one is at the side of your hip, and posterior is behind. It's at your seat, okay? And where your incision is very important to know because that is where you're going to focus all your strength exercises. And you're not going to just limit exercises to that area, but you're going to make sure you have at least 2 strength exercises to strengthen where the incision will be. So for example, if you're having a lateral incision, you want a couple of gluteus medius exercises, and those were the clamshells and the side leg raise. Okay, so there's different examples to where your incision is. Now, what happens to your body post-surgery? And the reason I wanted you to understand this a little bit is this is why it's so important to not just jump into any exercise program post-surgery. And this is what makes hip replacement exercises so specialized. The very first thing you need to know is after surgery, it actually takes 6 weeks for your soft tissue to heal. And that's actually a healing process that your body needs. And during that time, it remodels and repairs. and you do not want to load your body during that time. You want to be in the supervision of a physio during that time. We actually often would not see people until the 8-week mark. And we would say, you know what, stay with your physio till the 6 weeks, do the exercises recommended by them, and don't push your activity. You know, people who want to progress faster or feel they're not progressing too quick, well, you know what, the 6 weeks of healing, everyone needs to abide by, and they need to rest, and they need to not push advancing in their ability because your body's healing. Okay, here's the great news. The pain is reduced a lot post-surgery. And this was so rewarding to see. We would see people in our class pre-surgery, they'd come in afterwards, and after they had done their physio and after their 6 and 8 week mark, and they'd say, Jody, it's incredible. I have no pain. I don't feel pain there anymore. This is amazing. And so they were just thrilled that the pain they had pre-surgery was now gone. What this means is you now can build on that. You've healed, you have no pain. And so now you can build your muscle strength back up. But here's what you need to know. You may have some muscles that are so weak that they don't know how to fire anymore. I always use the word fire, and what that means is contract. They may not even have a contraction ability, okay? So we very first of all need to work on getting the contraction back in the muscles that may not be working for you. That's the very first step, okay? And your body, because it's been in pain, it's been in protection mode. And all of that, it's actually, your body stays in that mode until you teach it doesn't need to be. So your body actually needs to relearn that it's no longer in pain. And I can't tell you how many times I've worked with people and say, you're clenching, you're protecting, you know, you're making fists and your whole body is so tight. They don't have to do that anymore. And they had to relearn that. And their muscles had to relearn. They're not in pain anymore. We do this by releasing muscles, by stretching them, by working them through pain-free range, and then we rebuild. That's the strengthening. So the wonderful news here is your body absolutely can be healed. You're going to stretch it and you're going to strengthen it. And keep in mind that you need this repair process. You need to relearn. We're going to release you and we're going to rebuild you with the exercises. Now, I debated putting the screen on, the next one you're going to see here that says recommendations for exercise post-hip replacement. This is a bit more for people who are working with clients that have hip replacement post-surgery and doing exercises and making exercise programs for them. But I kept this on here that I'm just going to kind of really whip through, because if you are someone who is doing exercises at home on your own, I want you to be aware of a few of these things. This is a program meant to be if you're training yourself. So very first of all, I want you to know, I want you to stick to your physio's guidelines and what the surgeon has said for you to do for the first 6 to 8 weeks post-surgery date. So if your surgery date was March 29th today, you're going to wait 2 months and you're going to do the exercises they recommend for those 2 months, and then you can jump into the other exercises I'm going to recommend and seeing a trainer and all of that information. We saw time and time again touch training. What I mean by that is if your seat muscle, your gluteus maximus and medius muscles aren't working, if you poke them or you let your trainer touch them, it actually helps that muscle activate. So use touch training. We touched on this already. I really want you to keep in mind you're just working muscular endurance. That means low load and gradual increase of repetitions. There's a wonderful option for strength exercises that we can use and a trainer can use with you. It's called isometric strength exercises. If you have pain through a certain range of motion, we can actually strengthen you without going into that range of motion. And it's a very specific methodology that we can use where you can gain strength when you have pain through range of motion. We talked about unilateral or single leg exercises. Keep that in mind as you're choosing exercises. We're going to show you, and you can focus on functional exercises like the squat. And I'm going to share with you, I'm about to share with you the range of motion restrictions that you need to abide by. And these aren't just up till the 8 weeks post-op. Often it's at least to the 3 months and much longer than that as well. Okay, so What can you do for cardio post hip replacement? So there's some changes here. Walking is by far the most important. So the upright bike is great. It's great to get on post-surgery and initially post-surgery for range of motion. But the second your weight-bearing restrictions have been lifted from you by your surgeon or your physio, walking is going to be really, really important to get your strength back. Gradual increase of time or distance. You can walk outside, you can use the treadmill, you can do pole walking. My only restriction around pole walking is I don't want you to rely fully on the poles. I want you to do some walking without the poles as long as you feel balanced. And if you're using the poles, make sure you're not weight bearing with your arms too much on them, because I find some people can use them as a crutch. All right. So I mentioned the upright bike already. Again, it's fantastic. A combination of the two, walking outside or walking on a treadmill and upright bike, is a great combination. There is a machine called the New Step, and this is a great machine if you're going into the gym. You can definitely use that. And the last one I'm going to comment on is the elliptical. Yes, we had so many people love the elliptical. In fact, we had to limit the time on it for people because they loved it so much. Yes, it is okay. Yes, it is range of motion for your hip, but I have a concern with it, and I'm going to share a story with you. The elliptical makes you plant your feet. Your feet never have to lift off the pedals, so it's supporting your body weight. Here's what happened to one of our clients. It was such a good learning lesson for him. He recovered quickly. He was kind of a younger 60-year-old and quite active, and he had done the treadmill, but his favorite machine was the elliptical. So he got out of the habit of going on the treadmill, and he just did elliptical all the time. But he was also a golfer, and he would golf. And he was fine at first golfing, and he was able to walk the whole 18 holes. And then a few months in, after being able to do golf and do the whole course, he came and he said, something's changed. He goes, I'm getting pain at, 9th, 10th hole, and I can't complete the course. He goes, I don't know what's changed. And again, we did the investigative approach, and I kind of said, what are we doing different in your daily routine? What are you doing in your exercise routine? And he had started to do exercises independently, so we didn't know what he was doing. Well, it came out that he was only using the elliptical, and he was going on it for 30 minutes. Here's what happened to him. He never had to transfer his body weight on the elliptical because his feet are glued to the machines. So his body never had to transfer onto the operated leg, and unconsciously and probably habitually, he was probably continually putting more weight on the good leg and not strengthening the operated leg. So the second we got him back on the treadmill and a combination of the two and doing a bit more treadmill, he was back walking the full 18 holes pain-free. So just don't limit yourself to just the elliptical if that's your favorite machine. And the one recommendation I will say, if you're doing cardio on your own, is please gradually increase both the time and the intensity, and have a trainer figure out what your target heart rate should be, and then you can monitor it from there. Okay? So here are some of these restrictions. I absolutely loved the head physio that we used to have at the hospital, because she was very, very strict. And it was really funny because she was probably in her 40s at the time, and, working with people in their 60s, 70s, 80s. So people who were older than her, but she was like a school teacher. And here's why. People were actually afraid of her. If they did a movement that they weren't supposed to do because it could put them at risk of hip dislocation, she would let them know, and in a very stern way. And I would have them come into my class and say, Jody, she yelled at me across the floor and embarrassed me. And I would have to say, did you learn your lesson? They said, of course I did. But here is why it's so important. If you go past some of these ranges of motion after having a hip replacement, you absolutely could dislocate your hip. And so the reason she yelled at them was for their own safety, and actually to make an example out of them so other people would see how serious it was. So I'm going to go through these with you. If you've had a lateral incision, you need to avoid external rotation. External rotation, just to give you an example what that looks like, I call it the guy sit. So you know how guys sit and they pull one leg up and their ankles across their knee? Or maybe a better example is if you go to put on your shoe and you lift your leg up and put it across your knee to tie your shoe. that is external rotation of the hip. That is the worst move you could do, and it could dislocate your hip. And it is a guideline that you have to follow at least for the first 3 months, and I would recommend longer than that. Internal rotation is a bit harder to describe, but what internal rotation is, if you were to stand and either turn your toe in or cross that leg across the midline of your body, that's internal rotation of the hip. A better way to maybe even give you an example of what might cause internal rotation, if you're in the kitchen and you're planted on your feet and you rotate your body to turn to talk to someone or grab something without moving your feet, you've internally rotated the hip, okay? I'll do a video of that one. That one's a bit harder to describe without a visual. Hip flexion past 90 degrees, this one's really simple. Those of you who've had hip surgery already know that you have to sit at 90 degrees, and they're actually going to give you cushions to raise your seat up if you're really tall so that you don't go past 90 degrees. And sitting in a low car, sitting on a low couch, sitting on a low toilet could all be past your 90 degrees. That's why they give you a toilet raise after surgery. So watch the 90 degrees. And I will tell you, the only person I knew who dislocated their hip was someone who was sitting at a dining room table. Now, granted, she was very light and a very frail, kind of thin body. And she didn't have a lot of muscle that had built back up. But she was sitting at a dining room table and her napkin dropped and she reached forward to grab the napkin. And that's when she dislocated because her hip angle changed past the 90 degrees. So those are all if you have a lateral incision. Anterior incision is a bit more simple. You just really have to avoid two. You have to avoid hip extension, which hip extension is moving your leg behind your body. So that can be if you're lying prone and you lift your leg up behind you, that is hip extension. Bridging is a form of hip extension. So you need to watch that at least for the first 3 months or as long as your physio and surgeon has recommended. And again, as I described above, if you've had an anterior incision in front of your hip, you want to avoid external and internal rotation too. Now, if you've had a posterior incision, this is one on your behind, okay? You want to avoid hip flexion. The best way to describe hip flexion is if you were lying down and you grabbed your knee and pulled it toward your chest and actually pulled it all the way to your chest, that is a very deep hip flexion. 90 degrees would just be pulling your knee over your hip. You want to avoid hip flexion. And a good way to describe when you might have hip flexion in everyday activities is a deep squat. So if a really low toilet again, a low couch, if you're a gardener and you're dipping really low into a squat form in the garden, you need to be careful of that hip flexion and those deep squats if you've had a posterior incision. Okay, so let's get into some specifics, and I want you to know you can see all these strength exercises, and I'm going to share more of them. I've got videos, they're on my blog. You can see more of them there. So just quickly to go through these, some of the best exercises you can choose: the clamshell, the side leg raise. For the hip flexor, it's really kind of knee lifts, and you can add resistance to those. Bridging is a great one for people who've had the lateral or posterior incision. Squats are good for almost everyone within a certain range of motion. These step-ups I haven't talked about yet. Post-surgery, excellent form to regain function, especially if you live in a home with stairs or need to take stairs for work. You definitely need to be doing front and lateral step-ups, and I'd recommend starting with one riser platform. I've talked a little bit about the shuttle. The shuttle, you'd have to go to a weight room for. It's not essential, but it is a great machine. This was another favorite of our clients. We had trouble getting them off of it. We'd almost have to say, hurry up, the next person needs to use it. And the shuttle, the reason we would like you to get on the shuttle is because you can do one leg exercises at low intensities to build your strength up. And core stability exercises, so important to do. That again is going to stabilize your pelvis and help your posture and just overall stability and balance. What do all those exercises have in common? They all strengthen your hip and your whole pelvis structure. And I have some words here that says start local at the core. And local means start at your center. I want you to start exercises that build from your center first. So all those functional exercises like step ups and squats, if you don't have a strong core, if you don't have the deep abdominals and the side glute muscles and the posterior glute muscles, if you don't have those built up, you're not going to be ready for those functional exercises. So we want to start central, start local, and then add in the functional exercises afterwards. So keep that in mind as you're creating your exercise program. Okay, a lot of people say, how often do I need to exercise? It depends depending on the type of exercise. So I've listed the different types here. Strength exercises, if you can do 2 to 3 times a week, you are going to see results. And I want to make a comment here. Don't be an all or nothing person. If you can't do 3 times a week, 2 for sure is sufficient. You're going to see results. 3 is just optimal. Cardiovascular aerobic conditioning, 3 to 5 times a week. Our national health organizations will actually recommend now, they recommend 5 days a week of light to moderate exercise for a minimum of 30 minutes. It's actually increased to more than that now, to 45 minutes. Now, you don't have to think that's high intensity or having to go to the gym. It just means, you know what, getting out for a walk. If you're getting out for a 15-minute walk twice a day, that's going to get your aerobic fitness in. You just have to elevate your heart rate past rest and into your target zone. Stretching can be done every day if you wanted. I'm a big believer in rest, so I think stretching 5 days a week is excellent. Again, if you're an all or nothing person and you know you're only going to do 3 days a week, stretching 3 days a week by far is going to give you results. I just recommend optimally 5 days a week, but you can do it every day of the week. Range of motion can be done daily. And the reason being, it's going to lubricate your joint. It's going to make you feel more mobile and just loosen you up overall. Now, I wanted to bring up the importance of rest here because we saw so many clients, and I didn't think this was possible, people wanting to exercise. But if you are a type A personality or absolutely love exercise or just a go-go person, you need to know that you need 2 days a week of rest and ideally space between your workouts. We would see people starting to actually go backwards in pain strength, backwards in how they felt overall in their body. And detective hats on, investigative questions full force, we would find out they were doing too much volume in a day, too much in a week, and they just needed to implement 2 full rest days in the week. So if you know that's your personality, if you know you could be guilty of doing too much, please remember to put 2 full rest days into your workout. All right, we're almost wrapping up here. I just have a few more important points here. So how long do you need to exercise for post-surgery? This is really, really important because you know what? A lot of people see surgery, they see it as an injury. And what do injuries do? Injuries get healed. And once you don't feel the injury anymore, you move on. So we had a lot of people coming in with a mentality of, I've done my physio, I'm done. I've done my physio, I've done a couple months with you, I'm done. And then you know what would happen is we would see them a couple months down the way, 6 months down the way, and they'd say, I'm back. I stopped too soon, or I've fallen backwards, or I'm in pain. And what they realized is they needed to keep going. They didn't go long enough. They weren't able to do things they wanted to do. They didn't have the progress they thought they would by the time after surgery that they felt they should be at. And here's what was super interesting. We had some real diehards in our program that stayed for a year, that stayed for 2 years plus. You know, some of them were with us 5 years, and they'd come 2 or 3 days a week. And it was so rewarding and so exciting because at the year mark, we would have those participants say, Jody, I didn't know I could progress to this level. And I didn't have this at 6 months. Those same participants at the 2-year mark would share with us. We wouldn't even ask them. They just, share what was going on in their bodies and their health. They say, Jody, you know what? At the 2-year mark, I'm still getting progressions. I'm still getting results that I didn't know I could get and that I wanted. And it was just so exciting. And so when people say, how long do I have to keep this up for? Or how long should I exercise for post-surgery? They never liked my answer, and you might not like it either. But I would say forever. It's a lifestyle thing. But here's the thing. I would absolutely recommend 1 year minimum. If you want the best results, 2 years. And this could be a 2-year commitment of twice a week. It could be a 2-year commitment of 3 times a week. And obviously, optimally, depending on what you do, what your activity level is, how you want to feel, what you want to be able to do, I would recommend ongoing, minimum twice a week. Often people would say, what's better? Do I need to do 3 days a week? I would actually recommend 3 days a week when you're first starting out. And then once you get to a certain level and are able to do a specific amount, we did see people with twice a week maintaining results and gaining results. So 3 times a week to start, 2 times a week after that, depending on your schedule and what you know you can commit to. So just bringing this all together, why am I such a huge advocate and so excited for you to know the huge benefits of exercise? Here's everything it can do for you. You're going to be able to walk better. It was a pet peeve of mine to see people limping. I was determined to make sure no one was limping post-surgery, and no one wants to limp. So you can have better gait. You know what? The freedom to be able to walk as long as you need to walk for whatever you're doing in a day. You're going to build your endurance for walking. Everyday activities are going to be easier. You're going to feel independent. Interestingly enough, a lot of people said, you know what, Jody, sometimes I catch my reflection in a store window. And I thought my posture was just terrible pre-surgery. They'd even say they felt that way a bit post-surgery. And they said, you know what, exercise has really improved my posture, makes me feel younger, and just makes me feel more confident. In addition to posture, overall, you're just going to feel stronger and more supple. And you know what? That makes you feel more youthful. When your body has flexibility and mobility and feeling free and less restricted, you feel younger and you just feel better and happier. Hence the picture of the man on the beach sitting past his 90 degrees with his arms in the air. He's feeling pretty free. He's feeling pretty good. And that's what I want for all of you. So what are the next steps? And we're almost done here. Here are the next steps that I want you to take, and that if you take are really going to help you, whether you're pre-op or post-op. I want you to get an exercise program created just for you and to follow, okay? So then step 2, you need to decide for yourself, when am I going to do my exercise? And cement it into your calendar. I used to work with this gentleman for so long. He was my longest term client. And he would say to me, Jody, my friends and family know I'm busy Tuesday and Thursday, 10 to 11. Nothing else went in the calendar on those days. It didn't matter what was going on. Those were his workout days, and that worked for him. So I'm going to get you to decide when, and I'm going to get you to put it into your weekly calendar. If you don't, what we normally see is other things fill in and it just doesn't happen. All right. Step 3 is actually begin. But part of beginning, where what I need you to do is I need you to monitor. I need you to monitor how you feel. I need you to monitor pain and progress. All right. Step 4 is every 4 to 8 weeks, you want to check and see. We used to do this probably every month. We'd be like, oh, where are they progressing? What exercises do we need to progress for them or advance so that they can keep getting stronger? You need to check in with yourself or your trainer every 4 to 8 weeks. And the wonderful thing about that is getting new exercises, progressing. It's going to keep variety in there and you're never going to get bored. All right. Now, how do you get an exercise program? You have 4 different options here. You can hire a personal trainer or kinesiologist. I highly recommend that. They're going to help you cue. They're going to give you technique progressions. Another option, you can look to see if your community has a group joint replacement program. And if they do, wonderful. It could be in the form of an arthritis program, could be through the hospital. Take a look and see where there might be a program. If there isn't, we do offer training for a whole joint replacement program to be put into a community center. You can also, there's so many excuses we all have for so many things for not doing them. I really want to take all the excuses off the table. I know it can cost money to see a trainer. I know it can cost money to join a program. I know sometimes there's no car to get there and time is limited. You know what? Option C, you can do a home program. I've devised a whole program in the form of an ebook and video, and it's for pre-op and post-op. You can follow it. You don't need to get to a gym. No reason that you can't begin today and know exactly what to do. All right. And option 4, you can get a consultation with myself as an expert, and you can get a personalized, customized program. It actually includes a one-on-one consult to start, so I can find out your health history and find out your goals and see what's going on with you. Then we're going to devise a program just for you. You're going to get that in a form of a written program and pictures and videos. And then we have a follow-up as well. Okay, so you have 4 options there. Here's just a bit more information. If you do want to find an exercise professional in your area, ideafit.com has a great resource called Fitness Connect. You can see the URL there. You can actually put in your postal code and up comes different personal trainers. You can see what their background is. Highly recommend you getting a trainer that has joint replacement or hip arthritis or senior training or the ACE medical exercise specialist certification, okay? You can get started today if you want to do a home program. You can see my website there, hipreplacementexercises.net. The price is normally $47 US. On my next screen for you today, all of you listening, a special promotion of $37. Just note that you're going to be charged the $47 and then right away you're going to be discounted back the $10. So for $37, you can get started with my complete exercise program that has come from years and years and hundreds of clients. The exercises we have done that have given them the greatest benefit. And if you really like the private personalized approach, let's do a consultation for you one-on-one. And I'm also offering a discount on that, and it's $20 off. So I really want to make sure I'm answering your questions now. I thank you so much for listening in and being here today, sharing the reasons